All right, folks, it's 11 a.m. I love to start meetings on time. So good morning, good morning, good morning. My name is John Jurisic. I'll be emceeing today's event. How's everyone feeling out there? On BC Family Physicians Day. How are you feeling? I've done a few of these. It's always good to have a very excitable crowd. Outstanding. Today we are celebrating grassroots advocacy. Today we are celebrating personal leadership. Today we are celebrating doctors and healthcare workers. And the people that can actually do something about our doctor shortage crisis are sitting in that building right now behind us. And apparently they can hear us. Right? So we're going to have to significantly ramp up the noise. By the way, I'm very impressed so far. But significantly ramp up the noise and cheering because we want them to know that the current situation is simply unacceptable. So throughout the day, when I ask you how you doing, I really need you to do, as you are doing, I need you to cheer and whistle and clap and yell loudly. So let's do this again for our legislators. How are you feeling today on BC Family Physicians Day? Outstanding. By the end of this session, you'll have no voice left. Okay? I would like to acknowledge that the environment and properties on which our legislative buildings are now located in Victoria Harbour are within the traditional territory of the Lekwungen First Nations, today represented by the Esquimalt and Songhees Nations. We have a responsibility to work towards truth and reconciliation and are open to suggestions and dialogue with local First Nations communities to learn how our collective communities, that includes each and every one of us, can better support and facilitate economic and cultural reconciliation. Our schedule changed at the last minute, so to speak. Our hosts from BC Healthcare Matters, Camille Currie and Alexis Reid, will be exiting the legislature in a few minutes as they witness their petition being tabled at currently over 41,000 signatures. So unfortunately, you're going to have to listen to me for a few more minutes as I review the scope and context of our event today. So bear with me. COVID is still amongst us. Please follow the health authority protocols. Hand sanitizers, masks are available at the booth over there. Thank you. We just wouldn't be celebrating and advocating so successfully today without the massive amount of work and support from everyone here and everyone from their homes today. This is streaming live. BC Healthcare Matters is entirely citizen, resident, and volunteer driven and is led by a team of volunteers that are extraordinary, passionate, and fully committed to securing more doctors in British Columbia. Yeah. Team BC Healthcare Matters consists of about a dozen volunteers. These amazing volunteers are located in and amongst the crowd. They are wearing blue shirts and are fully available and willing to take questions and listen to your concerns and stories. In fact, one is right here. Please allow me to reiterate the goal of the BC Healthcare Matters movement. We advocate for patients in the healthcare system. We give them a voice where they didn't have one. We amplify the voices of the people who are being left behind in this crisis. We put constant pressure on the government for action and demand transparency and educate our supporters. So how does that goal and objective manifest itself today on these lawns? Today we will hear about patient impact stories. We will hear doctor-based speeches and stories. And as stated, Camille and Alexis have delivered the petition to the government behind us. We will hear from Camille as they come back from delivering the petition, and we will hear from BC politicians speaking to our advocacy and objectives. We have invited government speakers from all three parties, and we expect to hear a few words from each of them. You'll probably have noticed a booth over there that includes a storyboard, an organization center. We encourage everyone to head over there, meet volunteers, write down some of your personal experiences on Post-it notes, your important issues, convey your anger, convey your frustration, convey your hope for the future. And all of those notes will be posted on the BC Healthcare Matters website at bchealthcarematters.com. So please engage with the BC Healthcare Matters crew and volunteers. If you've requested a sign, you can pick up a sign at that table. Pick up flyers, business cards. Now, when I wrote this down, I didn't entirely check that that was true. Is that what's going to happen over there? Do you folks have... There you go. Excellent. And you may have noticed that there are people in the crowd wearing black shirts. These folks who've decided to do that today, they currently do not have a doctor. You'll note some people are wearing white shirts. These folks currently have a doctor. And there will be many doctors speaking today. So I encourage you to engage. This is a community, grassroots-led effort. Engage, 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 and communicate. Leading me to emphasize again the most important activity that each and every one of you can undertake on a daily, hourly, and minute-by-minute basis is to own the message, to personalize it, to share it with your friends, to chat at the coffee shop and dinner table. Spread the word every day, and we'll get the right policies implemented by one conversation at a time. Right? 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 Okay. Now that the petition has been delivered, and you've demonstrated the strength of your voice and commitment, what do we now do next to maintain and continue momentum? What are the action items going forward? For our supporters, please register to the BC Healthcare Matters mailing list for future updates. This can be done via the website, bchealthcarematters.com. Click register to stay informed. Join the BC Healthcare Matters Facebook page at facebook.com/groups/BC Healthcare Matters, and Twitter page. That Twitter handle is at BC_GP_shortage. These social media conversations are very impactful. If you're not comfortable with that, get out of your comfort zone. We need to make a difference this time on social media, and those are the links I encourage you to join if you've not already been there. Write to your MLAs. In this digital age, writing letters to politicians still works. Demand transparency. Demand immediate access to primary care. Right around noon, a bunch of these politicians are coming out here. They're going to see this crowd, and we're going to continue to impress upon them change must happen now. Consider getting a lawn sign if you don't have one already. I see a bunch of signs here. That's fantastic. Register on the website for one, and or head over to the storyboard area as I've indicated. Not everyone can speak to the media. Not everyone is comfortable doing that. However, if you are approached and are so inclined, give them stories. We need to back up all of this advocacy with facts and stories and reality. Please do not feel a bit shy to do that. If you're, and the media folks I think are up, some of them are up here. Okay, that's not a good response. And soon watch for opportunities to volunteer with the later to be announced BC Healthcare Matters Society. And Camille will be going into those details later. Now, calls to action from our government. Those folks that are sitting behind there, soon to be listening to you. BC Healthcare Matters demands complete transparency. What does that mean? We need to know that the urgent primary care center's data, the cost, the patient visit costs, and the total numbers seen. The results and minutes from every working group meeting regarding primary care. The removal of NDAs. The removal of nurse and doctor gag orders. These are the things we want when we demand complete transparency. Right?
Woo!
Right? Yes? Louder! Let them hear! Louder! Man, what I could do with this crowd. That's great. We also demand urgent action to recruit and retain family physicians. An immediate focus on retaining family practitioners and clinics that are close to shutting down. Immediate, large-scale effort to recruit enough family physicians and primary care partners. We want primary care when we need it and where we need it. And an immediate restructuring of an increase in family physician compensation. Well, there's some excitement. Our leaders are coming up. However, in the interim, while they settle down and come out, we're going to hear some patient stories, as we will throughout the day. And doing that for our group today, our volunteers, is Sharman Minus. And Sharman's going to say a few words right now.
Hello everyone. I would like to thank you all for coming out to show your support for this important cause, the lack of family physicians in BC. I would like to thank Camille Currie and Alexis Reid for starting the BC Healthcare Matters movement and allowing a place through their website and email for citizens to tell their stories, and of course today on the story wall. I would also like to thank my fellow volunteers, Pauline Rittenhouse, Anne LeHave, Dr. Bridget Reedy, and Mike Aldridge for their work in passing out flyers and canvassing neighborhoods for the past 3 months. They're in the audience. We had the privilege of speaking with many people who told us of their difficulty in accessing necessary primary care. They told us how their lives had changed for the worse, simply because finding a family doctor in a timely manner is nearly impossible. This situation must change. Here are some examples. My niece, age 62, moved from Alberta 9 years ago. She had a history of cancer. She was unable to find a consistent family physician, and the health information was sent to a local clinic. The referral to an oncologist here for follow-up appeared to get lost, and then COVID happened. My niece has just recently passed away from cancer after weeks of trying to see a doctor, online appointments, extended wait times for blood work and tests. She ended up going to the ER to finally get her diagnosis. I know she would have been diagnosed and started treatment far earlier if she'd been able to find a family physician. It breaks my heart to think how many people are currently in the same position. Shame. I've had a family doctor for a few years, but my adult son doesn't. He has chronic health problems, but I'm a fit and active man in my 50s and rarely need to see my doc. I went to his office and begged them to let my son have my place. They couldn't do it. They were as upset as I was. I'm a young woman in my 20s with type 1 diabetes. My doctor retired a year ago. He told me all the complications I could get with this disease as I age and how careful I must be of my health. I'd like to marry and have kids, but I'm frightened that without continual, uninterrupted, in-person care from a family physician, I won't become a mother, let alone have a long life. My doctor retired several years ago and sent out a letter that he'd found someone to take over his practice. He introduced his replacement in this letter, and I was so relieved because I had high blood pressure and atrial fibrillation. A few months later, I got a letter from him saying it didn't work out, and we could have our files printed and sent to us for a charge. 2 years later, I had a heart attack and an emergency angioplasty. That was it, and I still don't have a family doctor. That's me.
Shame! Shame!
This is my last story for this segment. My mother-in-law had a history of cancer and was supposed to get regular screenings, but it never happened because there was no GP to arrange it. Recently, she started feeling ill, but walk-in clinics who didn't understand her complex history were unable to diagnose her. Finally, she went to the ER after she started coughing up blood. They diagnosed her with advanced lung cancer, which had already spread to her brain and liver. She died within a month. My wife did her best to coordinate her mom's care during her last days because there was no GP to do it. Our hearts are broken. My wife has lost her mom, and my young children have lost their beloved Nana. A GP would have almost certainly found the cancer sooner and may have saved or at least prolonged her life. They certainly would have made her last days easier and relieved my wife from the stress of trying to play doctor while preparing for the loss of her mom. Politicians, enough with the Band-Aid solutions. This shortage is killing people.
Yeah.
Train more doctors. Pay family doctors a decent wage and create a model of family medicine that is attractive to new doctors. Thank you for listening.
When you hear patient stories, as you will throughout the day, that's when this really hits hard. That's when it is imperative upon all of us to keep doing this every single day. And outstanding. Okay? I'm now going to introduce you to somebody. Some context. So I'm a digital marketing and communications specialist. I own a company called Harbor Digital Media, and I've been producing and participating in a popular regional podcast called the Victoria Rumble Room. About 4 months ago, we were approached by someone who we didn't know, asking to be interviewed about something she called BC Healthcare Matters. We didn't answer right away, but she was determined to get her voice heard. So we scheduled her for an interview, and oh my gosh! You know, once in a while, maybe for some of us only once in a lifetime, someone emerges within our collective consciousness that just makes you stand back and say, wow. Yep. Makes you say, who is that person who's so articulate, so determined, so passionate, and who immediately demonstrates extraordinary leadership? That person, everyone, is Camille Currie, and she's the energy and the passion and the leadership and voice behind BC Healthcare Matters. And we are so honored and blessed to have her be the lead community-based advocate for insisting that those politicians behind us do something about the BC doctors' shortage crisis. I'd like to now welcome Camille Currie.
Well, how do you follow that? I am full of all kinds of emotion right now because I am so awestruck to see all of you here today. Words can hardly describe what it feels like to see so many people come out to join us on this cause and to support us and support every resident of British Columbia's needs. My name is Camille Currie, and I am the founder and organizer of BC Healthcare Matters. So moved to see all of you here today, coming from all areas of the island and the mainland. I look out at you today and I feel so encouraged, motivated, and invigorated. Each of you coming here today is no small action. It is another huge step towards the amazing collaboration we continue to witness arising from this campaign. I know that our momentum is nowhere near its full potential yet, because I believe in each of you will leave here today more invigorated, excited to continue supporting this campaign for change. Yeah. My hope is that every one of you will leave here today with a heart full of hope, a mind full of knowledge, and an urge to join BC Healthcare Matters on our next steps to campaign for the family doctor everyone deserves. And share with you very exciting news that our petition of 42,000 signatures have been tabled. And that will happen, but in true political form, they keep talking. So, the good thing is they are talking about family doctors. They are sharing statements about the importance of this crisis, the importance of our family doctors that exist, that are here, and those that we need to encourage to go into this field. So within moments, they will be tabling our petition. And let me tell you, it is no small document. It requires an entire box this size. 42,000 of you. That's amazing. Thank you. Thank you so much. So, I ask you now, hold your signs high above your head, and I want to know, what does everyone deserve? This is a huge milestone, having our petition tabled. It is now up to the government to demonstrate what their response will be to our request for solutions now. If the government continues to not be transparent and continues to delay taking action, then we will continue to ramp up our efforts and highlight the need for action now. The power of one is the theory that one person can change the future. That one person's actions can actually change the lives of many. We all have that power within us. And I hope this rally today inspires you to see the potential in you. Speeches are written one word at a time. The greatest accomplishments begin with one idea. And the wealth of the team that developed around this movement started with one woman saying, "Enough is enough." It has been repeated to me a few times by political representatives, medical professionals, and citizens that they have never seen such a movement accumulate so much momentum in such a short time, or garner so much media and citizen attention. This campaign's growth has been nothing short of amazing, and you, all of you, have helped bring us to this critical, momentous day. I started this group because I could not sit idle while I watched my family and others struggle without a family doctor. I gather you are all here today for similar reasons. Perhaps some of you have no doctor and feel abandoned in a system that promised to build a stronger society by putting people first, but has not delivered on that promise. Some of you here today may have a doctor, but are not able to access your physician in times of need. Or perhaps some of your loved ones are without and you are here to support them. Some of you in the crowd are medical professionals here today to support your fellow colleagues and residents who deserve a family doctor. Or to even support your need for a family doctor, because even some family doctors don't have family doctors. Regardless of your status, unattached or attached, you made a choice to be here today, and I am so grateful you did. I stand before you today, as you can see, in white. In white, because my family has been fortunate enough to get a new family doctor very recently. So today, I am here as a resident with a family doctor who will continue to press forward in this campaign for all those that don't have a family doctor or need better access to primary care. My determination to pursue the needed changes in the primary care system will not falter. I will not yield in my pursuit for better primary care for all. I am a mother, a wife, and a complex needs patient. I have witnessed the benefits of having a family doctor that knows us, knows our conditions, and that grows with us. At this time, I would like to take a moment to acknowledge that today is Family Physician Day. And I would like to thank every one of you family doctors in the crowd. Thank you for choosing to pursue a career whose primary purpose is to maintain and improve the well-being of another. The family doctors are the foundation to our healthcare system, and without them, we have nothing but a fragile infrastructure that could collapse and erode away. So I ask you now, look to your left, look to your right. If you see a family doctor near you, say thank you. It is now with my great pleasure to introduce a very important woman that has stood by me since our first coffee date in January, Miss Alexis Reid.
Hello everyone, my name is Alexis Reid and I'm the project lead at BC Healthcare Matters. I never in a million years thought I'd see this many people on the lawn of the legislature rallying together for something that we can all agree on, that we all deserve primary care and we all deserve a family doctor. I'm so honored to be standing in front of you today. Today is the day that our petition is being tabled. All of our petition is being tabled. Today, we are showing the government that we will not stand idly by while our healthcare needs continue to be unmet. In just over 3 months, I've watched this campaign explode. I'm honored to have been given the chance to work with Camille and to help her build this campaign. Just a few months ago, one woman said enough is enough and decided to take action. None of us would be here today without her. She has shown us all how powerful the decisions and actions of one person can be, and one person can make a difference. We have made a humongous amount of progress in a very short time. Now, yesterday you may have heard that Premier Horgan announced that he and Minister Dix are committed to working with doctors of BC on, and I quote, a clear process with firm timelines in order to make tangible progress on this complex problem. Now, I personally am an optimist. I view this as an excellent step in the right direction. But we will not be placated simply by promises and announcements and statements. BC Healthcare Matters isn't going anywhere until every single British Columbian can see a doctor when they need it and where they need it. We have seen a massive community of people come together to pressure this government for change. And look at what we've accomplished. We see it here with the unbelievable energy and the passion you bring here today. When I wrote this speech, I had no idea what this would look like. This is unbelievable. This is beyond my wildest dreams. I want to say I am incredibly motivated and inspired by everybody here today and at home, and so proud of our community and our supporters. Everyone here and at home is completely vital to this campaign. We owe every single success to you and to the efforts of our community, so thank you for that. We now see that the thousands of petition signatures and MLA letters that we have put forward are working. The government is beginning to respond to our efforts and to the plight of almost 1 million people without a family doctor. This rally today is just the beginning. It is vital that we keep this momentum going. I hope to see every single one of you in our emails, on our Facebook group, writing letters to your MLAs, continuing to support this campaign. Thank you so much to all of you. Thank you to Camille Currie. Thank you to all of our volunteers today. We absolutely wouldn't have been able to do this without you. Thank you.
What just happened? A couple of extraordinary people demonstrating an advocacy for all of us. Come on, let's rock this place. Let's let these politicians know that we mean business. And what would any event be without the world-famous Raging Grannies speaking to this issue, well, singing to this issue. And I know the songs, they're pretty cool. We can do a little jig. So this is a chance for you to have a little bit of a, you know, sort of physical break here. For all of the speakers that are going to come to the mic, do speak and present your voice, please, because apparently folks at the back can't entirely hear us. At the back, can you hear us? Yes. Yes.
Okay, we're the Raging Grannies, and we're furious about the situation of public health and the lack of doctors. We're furious about it. I don't know what else to say, and thank you, everybody. We just have to keep this up till we get doctors.
Here's a tune from the 80s, 90s, you might recognize. A little more recent than most of our stuff. Hot fever tonight and cold, cold sweats. We haven't been able to find a doctor yet. We need you to prescribe our meds to help us get up out of bed. Doctor, doctor, where are you? We got a bad case of missing you. No way to cure our blues. We got a bad case of missing you. A serious case, a failing heart. We're in rough shape. Where do we start? We're 109th on your wait list. Tell the government now that we are pissed. Doctor, where are you? We got a bad case of missing you. No way to cure our blues. We got a bad case of missing you. We got a bad case of missing you. Both of these songs, by the way, are written by Charlene here. You passed a kidney stone, and what do? You can't find a doctor and you're 92. You call eHealth and hope you get through. It's a long, painful wait, and when you do, you're told, get to emergency right away. You should see a doctor right away. So you sit in the emerge for 7 long hours. Your faith in our healthcare definitely sours. A lot of doctors hoped, a lot of doctors tried to give us their best while their hands were tied. Trying to run a business with a 10-minute guide, and meanwhile our public healthcare died. Where have all our doctors gone? I think that our government has got it wrong. Doctors treat patients and pay them well, so we can get out of failed healthcare hell. A lot of doctors hoped, a lot of doctors tried to give us their best while their hands were tied. Trying to run a business with a 10-minute guide, and meanwhile our public healthcare died.
Outstanding. Come on, let's let everyone know, all the way up and down the island, how much we love the Raging Grannies. Okay? We're going to start getting into some of the doctor speeches. These extraordinary people in British Columbia are now sitting up here. These are doctors, and they're saving our lives, and they need our help. Let's give a big hand for them. A question has been asked of me from the crowd around what is this petition that had been delivered to the legislature? What is the meaning of it? What does it do? And I've asked Camille to answer that, ad-libbing. And so, in issues of advocacy, in issues of making our point to the politicians who have the keys to legislation, often demonstrating that a lot of people support that point of view is helpful. And that is what a petition does. And that is what a petition in this instance has done. But I will let Camille give a whole lot more substance to that explanation.
So, just following up on, as John explained to you, yes, a petition you can think of as a vehicle. The petition is a vehicle for us to express within the BC legislature that this is not acceptable, and it is an opportunity for the government to respond to us with tangible solutions and plans for actions that they will implement in response to our petition. This is only the first stage of our endeavors and what we will do to get the change we need.
Thank you, Camille. And certainly any other questions at any point, please feel free to head over to the booth. There are folks there that can help answer any questions you have. So, you know, if I didn't say this, I'd be in trouble. Besides my family and my wife, the people I love more on this planet are our healthcare workers and doctors. Okay? Imagine a world without these folks in it. And they're behind us. And one of the leaders of that community is Dr. Jennifer Lush, a Victoria family physician who's been outspoken on the media, being quoted in the legislature. And she's now going to chat with us and give us some stories. Thank you, Jennifer.
Wow, look at everyone here today. This is extraordinary. And as a family physician, sorry, this happens often. This is extraordinary. And as a family physician, this is humbling, exciting, and encouraging all at once. It has been a long time since the day I can still clearly remember when 5-year-old me sat in my own family doctor's waiting room, listening to my mother read me a picture book in which there was a female physician, and the revelatory wonder I felt as I realized that I, too, could be a doctor one day. And ever since then, that is all I ever wanted to be. When I entered medical school, it was with the dream of becoming a cardiothoracic surgeon, and I successfully completed electives in that field. My general surgery preceptors encouraged me to apply to a surgical residency program. But as the time neared for declaring my specialty, I realized that I enjoyed all aspects of medicine, and I didn't want to narrow my focus to one specific area. I cherished the opportunity to build an ongoing relationship with patients over time. It was clear to me that what I wanted to be was a family doctor. All medical students entering medical school pass the same interview process and the same exams. Family physicians are not inferior physicians. We are family doctors by choice, not by default. Rather than specializing in one disease or body system, we have chosen to specialize in the patient as a whole. We bring expertise to the table, just like any of our esteemed specialist colleagues. But our expertise is an expertise in our patients, across all the lifespan and in all the body systems and in all the generalities of the human condition, medical, social, psychological, and spiritual. Having a family doctor reduces hospital admissions and ER visits, improves health outcomes, and reduces all-cause mortality. Adding just 10 family doctors to a population has a 250% greater influence on life expectancy than a similar increase in specialist physicians. We are the specialists in primary care, and therefore we deserve to have a seat at the table in any discussion of primary care reform. The public appreciates the critical role that family doctors play in healthcare. We hope the government is prepared to acknowledge this too. The great and respected Canadian physician, Dr. William Osler, said, "The good physician treats the disease. The great physician treats the patient who has the disease." To all my fellow family doctors who are here in this audience today and listening online, I say, you, by definition, are great physicians. Please do not give up. I know you may feel exhausted, demoralized, and burnt out. We have all been there. You have spent the first 25 or 30 years of your life in school, most of you doing at least 11 years after graduating high school, and 10,000 or more hours of clinical skills training before you ever got to practice medicine. You entered medicine to help and to heal, but it can be hard to keep going in the face of increasing complexity, mounting paperwork, and the challenge of continuing to provide the exceptional care we are trained to in an increasingly overburdened and broken system. For all the times you wondered if putting your own health on the back burner, missing family events, and going without sleep was worth it, look around today. This rally, these crowds are a sign that you are worth fighting for and that what you are doing matters. But you are also human, and you should not have to sacrifice your health and your happiness in order to care for your patients. You do not have to work for free. You are not just a GP. Hold your heads high and stand alongside the public of BC as they fight for the right to have a family physician who cares for them. Our hands are so incredibly privileged to be the first to hold new life when a baby is born, and to hold the hands of the dying as they take their last breath. You dedicated your life to this work, and hopefully today is proof that your dedication is not in vain. A new future for sustainable family medicine in BC is achievable. We can all work together to find solutions to recruit and retain family doctors to keep all of us in community practice caring for British Columbians. To the patients of British Columbia, and now I am speaking to everyone here, because everyone, doctors, public, media, and politicians alike, will one day, sooner or later, find themselves patients in need of care. You deserve a family doctor. Whether you are here today and you have a family doctor you fear may close their practice, or you are one of the many without a family physician, everyone deserves equal access to someone who will specialize in them, their family, and their health. You deserve a physician who will invest in a longitudinal relationship with you, who knows your past and will get to know your dreams for the future, who understands your worries and your healthcare needs, someone with whom you can share mutual trust and respect, a family doctor who will reassure new parents as they worry if their baby is eating enough, who will walk with teens and their parents through years of finding new identity, who will help you navigate the terror of a cancer diagnosis or the overwhelming questions of chronic disease, and then support your loved ones and shepherd you as you approach your final breath. Family doctors will coach you to better health, to be your best self in life, and they will comfort you and cry with you in times of sorrow and death. They will celebrate with you in times of joy and when you rise above disease and setbacks. From cradle to grave, you deserve a trusted family doctor who will care for you and walk alongside you in every step of your journey. To every person here today, to all your friends, loved ones, and family members, to every single person in BC, You deserve a family doctor, just as everyone deserves a family doctor.
Dr. Lush, thank you. Extraordinary. Thank you, thank you. Thank you for all of the advocacy and all of the commentary you've done on behalf of this issue. Now I'd like to introduce to you Dr. Adrian Yee, a Victoria Hematologist.
Thank you. Thank you for inviting me to speak on the Family Doctors Days in BC. I'm grateful for Camille's leadership. Can you please join me to give Camille and Dr. Lush an applause? I'm grateful for them to advocate for equitable access to healthcare. It is an honor for me to be here. My name is Adrian Yee. I am a hematologist. It is a privilege for me to be on the unceded and traditional territories of the Songhees, Waisanish, and Esquimalt. I've been in practice for 17 years. I'm passionate about equity, diversity, inclusion in healthcare. When I was in high school, I read a book about Tommy Douglas, and I can tell you that he is one of my heroes. I'm going to start with a quote from Tommy Douglas. Let us not forget that the ultimate goal of Medicare must be to keep people well, rather than just patching them up when they get sick. I don't think we should forget that. This is why we have a system that works for people. The current government promises us that they will improve the system so we will have timely access to healthcare when we are sick. They promise us that they will prioritize team-based primary care and provide dignified care to seniors. That was what I read on the mandate letter to Minister Dix. I would argue that they have not delivered on both promises. The reality is 1 in 5 British Columbians do not have a family doctor. And the situation continues to deteriorate day after day after day after day. Many of my patients tells me that, and I quote, "My family doctor retired a few years ago, and I cannot get into the urgent care clinic to see anyone when I am sick." This is terrible. And we have to learn, how did we come to this point? People cannot access essential primary care in our communities. Walk-in clinic and urgent primary care clinic are not the solution. They do not provide continuity of care. Every time you go in, you see a different clinician, and you have to repeat the same story over and over again. And they have no idea who you are, what's your preference, and what are your goals. Every time you start from point number 0 again. If you cannot seek care at urgent care, you can only go to the emergency room. You will soon hear from my colleague Simon about the emergency health services and what are the challenges that we have. When I look at the data, the average wait time for emergency room now in British Columbia is 8 hours. Whether that could be adult or could be pediatric. If you try to access the urgent primary care clinic, you have to phone multiple times for a non-existent appointment because they are all at capacity at 8 a.m. This is entirely unacceptable. Imagine bringing your child to the BC Children's Hospital emergency room. You sit in the waiting room and you wait for 8 hours, wondering whether your child has anything worrisome before you can see a doctor. Imagine how difficult and how unkind this is to our people in the community. It's all because we do not have access to essential primary care. In my practice, it is not uncommon that I see people with life-changing diagnoses. When they come too late to care, one of the most common themes is, I cannot access anybody because my family doctor have retired. I can tell you a story. One of my leukemia patients sought care at the emergency room because by the time they were sick, they were very sick, so they went to the emergency room. But because of the multiple medical issues that left unaddressed, it was very challenging to provide the optimal care for the leukemia. So by delaying the care, it has compromised the outcome. In my practice, I also have many older adults patients that I see. More and more, they have a longer list of medical conditions. They have a longer list of medications that they are on. They could come with diabetes, kidney conditions, heart conditions, arthritis, so on and so forth. Juggling cancer care and cancer treatment with multiple conditions, it's very complicated. Without a family physician as the quarterback or as the main pillar of care, I often find myself playing the Jenga game blindfolded with many other specialists that we do not have a single person or single entry to coordinate the whole picture for the patient. This is unacceptable. Without a family physician, more and more my patients ask me to address their primary care concern. Whether that could be their heart diseases, could be their diabetes. That further perpetuates the problems with access. And my patient is not having the right person to address their concern. I'm not capable to look after the combination of medical issues and provide a whole person care. That is the specialty of family medicine. Patient needs a family doctor to advise them, to counsel them, to guide them through their healthcare journey, to provide information, to allow them to make comfortable decisions of their care throughout the journey. This is very complicated. Episodic care is not appropriate and it is unsafe. But this is what we are facing in British Columbia today. We have a system-level problem that has continually, disproportionately impacted individuals in our community. Primarily are the isolated older patients that live on the margin of the society, or they cannot advocate for themselves because of the disability or their medical conditions. Imagine, how do you access TELUS Health when you don't have a cell phone? In our current worldview, we value equity and inclusion. The healthcare system is not equitable, neither is it inclusive. Our healthcare system is in a crisis. It has not kept people well, neither could it patch people up appropriately. Instead of providing meaningful answers, I'm disappointed with the divisive rhetoric and the vague answers. Minister Bates, I want to hear a real solution and a plan. Our family doctors are vital resources for our community. Please work with them respectfully. Thank you for inviting me to speak.
How inspiring is that? Whoa. So we have Dr. Sharman Hookworth. Close enough. An emergency room doctor in Victoria who worked till 3 o'clock in the morning last night and has come here to tell us his stories. And he's allowed us to just move you in the schedule a little bit. There are some politicians here who are going to say a few words. But before we do that, we're going to do an old-fashioned rant, okay? And so I'm going to start it. And you're going to reply with doctors, okay? What do we deserve?
Doctors!
What do we deserve?
Doctors!
What do we deserve?
Doctors!
Not bad, not bad. We're going to want these windows and doors to shake. They're going to hear our message. What do we want?
Doctors!
What do we deserve?
Doctors!
What do we want?
Doctors!
Oh, it feels good. I'd like to now introduce MLA Shirley Bond, Valemont, Prince George Valemont, MLA for Prince George Valemont, representing the Liberal Party. Shirley?
Well, good afternoon. And I can tell you that if there's one thing we agree about, you deserve a family doctor. Everyone in British Columbia deserves a family doctor. I want you to know that I am the health critic for the opposition, and I bring you regrets from our leader. Unfortunately, he was not able to be here, but I want you to know that while we may not be in that building, we hear your voices. And I can tell you, we have heard from families and from physicians across British Columbia stories that should not be happening in this province. The fact that you have to be on the lawns of the legislature today speaks volumes about the frustrations and the desperation that you and thousands of other British Columbians who couldn't be here today want to express to the people who govern in this building. I want to recognize particularly Camille Currie and BC Healthcare Matters for stepping up, speaking up. We know that it is not easy, but without your voices, the change we need will not happen. Today in the legislature, I was pleased to present on behalf of BC Healthcare Matters a petition of almost 42,000 people who are sending a message to this government that change needs to take place, and it needs to take place now. I want to express our deepest gratitude to the men and women who work in healthcare in this province. This isn't an issue. That is not a partisan issue. All of us understand the extraordinary efforts that were made, especially during the last 2 years. They went to work so we could stay at home, and we are deeply grateful, and that will never be forgotten. But as we speak, 1 in every 5 British Columbians do not have a family doctor, nearly 1 million people. And do you know what happens? People are told to go to walk-in clinics that have the longest wait times in the country under this government's watch.
You guys started the cutbacks. You buddy this. This one just continuing.
Hospitals are over capacity, nurses and doctors and healthcare providers are exhausted.
That's what you
And
wanted.
doctors are closing their practices.
You started
And
the cutbacks.
many people do not have a family doctor. And I can tell you this,
Liars.
that as long as
All of you, liars.
British Columbians continue to struggle to feed their families, to put gas in their cars, I can tell you this, that British Columbians were shocked to discover that this government is undertaking the most expensive project, museum project, in Canadian history right over there. And at the same time, in this neighborhood, every single UPCC was at full capacity by 8:45 this morning, while we're investing in a $1 billion museum. So families like yours deserve a family doctor. And this morning when we met with family doctors at breakfast, one of the things that they said to us, they enter family practice because they want to care for us from birth to death. But they can't manage these practices with the overhead costs, all of the issues they're facing anymore. And in fact, we have new medical grads who have made a decision. They want to be in family practice, but they are considering not doing that. So today we join you in that call for action. It is about priorities. It is about policy decisions. And a good start would be to cancel the $1 billion museum project across the street and invest those dollars in supporting healthcare professionals. I can say this to you. It is time, and they can ignore the voices of opposition members all they want, but they should not be ignoring the voices of families and patients and doctors and nurses and exhausted healthcare providers. This is a crisis. It is their job to deal with it, and we join you in that call to action.
Thank you, Shirley Bond. I'd now like to introduce MLA Adam Olson, the Green Party MLA from Saanich North and the Islands.
It's a beautiful day here in Victoria. Thankful that the skies have held off so that we can stand and advocate for the better health care of British Columbians today and into the future. My name's Adam Olson. I'm the MLA for Saanich North and the Islands, and I'm proud to stand here as a representative of the BC Green Caucus in this Legislative Assembly. I'd like to acknowledge all the speakers that have spoken before me. I'd like to acknowledge Shirley Bond. I'd like to acknowledge all of the family doctors, the people who have far more expertise than I do on this, and who have educated me over the last 5 years as an MLA to the situation that they face as professionals and that we face as British Columbians. I'd like to thank BC Healthcare Matters, Camille Currie, for organizing this event and for bringing together the people to support our family doctors. continue to hear in the BC Legislative Assembly that no province in this country has more fee-for-service, and that that's the problem. It shouldn't also be the excuse for why the problem persists. So yes. I agree with that.
And it's not the problem.
So what I would say is that if that is the problem, then let's get on with finding solutions.
It's not the problem.
I also asked the question, why did it take so long to sit down and talk with the professionals about this problem? When I got elected in 2017, this was one of the key issues in my riding and one of the key issues in the region and one of the key issues in this province. We knew that this was going to grow into an even bigger problem, to the problem that we have today. Unfortunately, though, I believe politics has gotten in the way of this situation. What we need is a government that's focused on fixing a broken primary healthcare system so that we as people and so that we as the government can look at that universal, equitable healthcare system with the pride that we have looked at it for generations. We need a leadership style that listens to the professionals. Not driving a message from the top down, but understanding what communities need and building systems and putting resources in place that help address the unique issues that our communities have. I'm an MLA of a wide variety of communities. I represent 3 municipalities on the Saanich Peninsula where there is about 10,000 people who are unattached today. We have more people moving into our beautiful communities who are unattached. We have people who have lived in our communities for decades, whose doctors have either retired or have decided to change their profession or change the focus of their work because of the exhaustion that they're feeling. I also represent island communities, which present a whole other challenge and require a whole other diverse set of responses from this government. We have a situation in Salt Spring, where a very powerful community came together and fundraised for an emergency department. That should not be part of our universal healthcare system. The capital investment should be made by this government. We know that good, quality, equitable, universal primary care helps people stay well and helps support people through their healthcare needs. We need to invest in that healthcare system. We need to put in place the policies that allow family doctors and their allied health professionals to deliver those services for us. It needs to be driven from the grassroots, from our communities to this building, and we need to once again have a universal primary healthcare system that is not in a state, a crumbling state, but one that is strong and serving the people of this great province. HCM, thank you for this opportunity.
Thank you. Thank you, Adam. Thank you, Shirley. A member from the NDP and this government was asked to speak, and so far we've not received any responses. So what are we going to do? What are we going to do? What do you deserve?
Doctors!
What do you deserve? What do you deserve?
Doctors!
I could do that all day. Oh my gosh. Well, we're going to listen to one.
Chicken!
We're now going to listen to Dr. Simon Hoogerworth, a Victoria emergency room doctor, who, for those of you who weren't here a few minutes ago, has been working since, worked till 3 a.m. this morning, doing the job of what we're trying to get more people to do and get more help for it. Sir, your turn.
Thanks for that introduction, and I won't be able to speak as eloquently to family medicine and how important a family doctor is as Dr. Lush did. I think we need to give her a real big applause for her push to get this issue to the forefront. I've been an emergency physician for over 20 years. I started in Ontario working in a tertiary care center there in a pediatric emergency department, and I came to Victoria over 20 years ago, and I've worked in both the Jubilee and the general hospitals here. I've been the lead physician, the chief of the departments of both sites at a number of times, and now I'm the lead of the group of the 50 emergency doctors or so that provide emergency care to the District of Victoria, the Island Health Authority, all the way up to the top of the island, where the major trauma center that brings things down from there, and referral center for the whole of Island Health. I've been able to see that the backbone of our healthcare system is our family physicians. They keep, not patients, they keep their patients, their friends, they become so close with them, they keep them out of the emergency department. They prevent episodic care that we are now providing all the time. The impact on your emergency services is great. It is difficult for us to provide appropriate emergency services when we are overcrowded, when we have no beds to see patients. And my shift last night wasn't atypical. I left at 3 in the morning, and both of our departments had a 6-hour wait. So you're waiting, earlier it was 8, so we did a little bit, that's good. But that's not unusual, and I think to myself, how desperate are people for care when they're willing to sit in one of those little chairs next to somebody who is sick and unwell for 8 hours. And many of those patients have chronic problems that have either decompensated and now have become complicated and require a lot of care, maybe admission to hospital, maybe it's a cancer that we missed and now they're going to be being past the time to get treatment. Many of them are just looking for a prescription to get filled, and they couldn't find one. They've waited for 8 hours in the emergency department. And this is not uncommon.
Shame.
We're so overcrowded, I walked into the department last night, and one of my colleagues was treating a seizing patient in the hallway. That would be surprising, but it didn't really faze me much because it's a common occurrence, not having the appropriate place to treat critically ill patients, because I felt like that frog in a boiling pot of water. It just slowly heats up, and it's become a norm for us. We've learned to adapt and to do our best. I'll give you just a few vignettes over my last week of work that gives you an idea of the impact of not having a family doctor can have on you. Some of them are inconveniences maybe, but I can't believe people do it. You're in your 50s, you've got multiple medical problems, you work hard during the day, you have the family to support, and you've been trying to get to a doctor to fill some prescriptions and get some basic longitudinal primary care that would be provided by a family doctor. You've tried walking clinics, you've tried the urgent cares, but by 8 in the morning they're all filled up. You have to go to work, you have to support your life and your family. So you set your alarm clock for 3 in the morning so you can get out of bed, come wait in the emergency department for 4 hours to see an emergency physician so you can get to work in the morning.
Shame.
People are doing this on a regular basis, we see that. It's not uncommon. Imagine you're a woman in her 80s, your family doctor was retired 2 years ago, you haven't been on your medications, and this is a patient that Dr. Yee, who's left, we'd referred on to, but a patient that you haven't seen a doctor for 2 years, you've noticed a lump in your breast. You think you should get it looked at. You try to go to a clinic, you can't do it. You're 80 years old, mobility's an issue. You can't get up at 6 in the morning to go to wait in line for 2 hours. 1 month goes by, 2 months go by, you sort of learn to live with this lump, and then it's a year. You come into the emergency department eventually, you wait 8 hours to see an emergency physician, and you've got an obvious breast cancer. There's certain things we can do to help you along in your journey to get this appropriately looked after and treated, but we don't have their skills. We're not specialists in family medicine. We're not a family doctor. We cannot provide the service to treat you appropriately and what you deserve. So this is not something we have to imagine. Unfortunately, this is something that we see on a daily basis. So it should be your expectation and your right to not be marginalized, to be able to have primary care access to a good family doctor who can take over that care. We can't do any of the counseling, any of the ongoing follow-up. Having cancer is confusing. It's difficult. It's hard to understand. You need someone to help you navigate that journey with you. Imagine you're in your 60s and you're on multiple medications. You haven't been able to get them filled because you have no family doctor. You're being unwell, you're getting unsteady on your feet, you trip and you fall, and you fracture your hip. Well, I'm an expert at helping you with your fractured hip. I'm an expert at helping you get the urgent services for that. But again, unfortunately, this fall is preventable. This admission to hospital and fractured hip is preventable if you have good access to a family doctor. The erosion of family medicine and family doctors has been going on for over 20 years. This is a long-term problem that needs quick solutions, unfortunately. I'm not in the solutions game. I was hoping just to outline today with a few vignettes of the impact of not having a family doctor has on the impact you have for your urgent and emergent needs when you come to an emergency department anywhere in British Columbia. So I'm hoping that movements like this can force government to take responsibility. That they can begin to work collaboratively amongst themselves and to work with family doctors and the professionals providing the care to find solutions.
Simply extraordinary, these stories. We've had someone from the crowd, Dr. Robert O'Connor from the Chosen. Anyway, he's going to come up and talk for several minutes about medical school, correct? This is unannounced, so I sure hope that's what he's going to say.
When I was 17 years old, the governments of the day said there'd be too many family doctors. So, spoiler alert, that young 17-year-old kid decided to become a family doc anyway, and here I am. How amazing would it have been if at that crossroads of history, there was people like this that got together and steered the government back onto track that made sense. British Columbia is an awesome place. We need to be able to fix the supports for governments so that we can expand the educational places for those who wish to join the front lines. Everyone can have a family doc that wants one, and maybe the young family graduating docs can afford to have a place to live while also paying for their staff equipment and so on. With a groundswell of democracy like this, one thing I do know, the beginning is near. Thank you.
Thank you. Now we're going to hear from Dr. Peter Gladstone, a Victoria cardiologist. We're at 12:30. We will be honest to our schedule, and we will be done by 1. Thank you.
Thank you very much. It's so nice to see everybody here, and hopefully it won't rain. I'm a cardiologist in Victoria, and I want to give this rally my complete and utter support. Because the collapse of primary care in this province affects everybody, not just the family doctors. Today, do you know that over a third of the patients that we send home after a heart attack have no GP to follow up with? Nobody to renew their medications or adjust them or see the complications that may develop. They're left to find basically a walk-in, which, as you've already heard, is probably closed by now. So they have nobody to help navigate their recovery from the heart attack. You see, qualified care by a physician after discharge is not an optional extended warranty program. It is integral to the patient's care journey. And the ultimate outcome of that journey depends as much as what happens afterwards as what happens in hospital. And so many don't have that opportunity anymore. And what's even more frightening is how many might have avoided the heart attack or stroke or advanced cancer in the first place with adequate primary prevention from a skilled, caring family doctor. Public health has taught us that it's the small things applied to everyone in a population that makes the big differences in a population's health, not the big interventions applied to just a few. Right. So how did we get to this mess? Well, it certainly didn't happen overnight, but it has become dramatically worse over the last 5 years under Mr. Dick's watch. Let me suggest to you a couple of myths promoted by this Minister of Health that are certainly part of the problem. Myth number 1 is that a family doctor is an expensive, frivolous luxury that we really don't need. His actions have always suggested this, but last week in this building, he basically just said the same thing by saying that better care was provided by nurse practitioners. Now, what are the facts? Don't get me wrong, nurse practitioners are a wonderful member of the healthcare team in a supportive role. But they're not physicians, and they can't be expected to provide the same kind of care as a family doctor can. And they're not cheaper. Did you know BC pays a nurse practitioner more to see a patient than a family doctor? Now, even more importantly is that Mr. Dix appears to have set one group against the other. And that doesn't help. We need to work together to keep this population healthy, using their skills and their training. They're not in competition with each other. You know, I'm in awe of what family doctors do. Almost everybody that I see coming into my office has got heart disease, which makes it easy because I can focus on one small area. But the family doctor, on the other hand, are on the front lines of medicine. The patient who walks into their office could have flu or cancer. They could have a headache or a brain tumor. They could have an infection or diabetes. It takes skill and training to diagnose and to treat. Mr. Dix, if you're listening, family doctors are not frivolous, they are foundational to our healthcare system. have tried. A recent report unfortunately ranked Canada 10 out of 11 countries in the world, ahead only of the United States, in terms of health care. But it said that the most important aspect was, in fact, a strong primary care system. All right, now myth number two. Myth number two, and this is one of Mr. Dick's favorites, UPCCs will save the day. Now, the government has spent $100 million on UPCCs across the province, and today, none is fully staffed and few provide any longitudinal care. They basically provide walk-in care 2 to 3 times the cost of a family doctor. In Victoria, less than 3,000 patients have anything close to longitudinal care through a UPCC. But here's the part that the minister doesn't seem to understand. You can put a UPCC on every street corner, but they'll be of less use than a Tim Hortons unless they've got doctors in them. Qualified doctors providing long-term comprehensive care. So look, Fort Rains, what to do? Mr. Dix, I'm sure you learnt your 3 hours in school, so here are 3 more for you to help focus your thoughts as you try and solve this problem. First of all, let's respect your family doctors. Respect them for the incredible work they do. Do not trivialize their work as you did last week. Statements that betray an ignorance of the fact. The people of British Columbia need family doctors and a lot more, and they are not replaceable. Number 2, reimburse them adequately for their training, skill, experience, and hard work. The GP sent me a screenshot the other day of a billing for the same patient for the same office visit 4 years apart. And the difference of the MSP remuneration was 39 cents. That's insulting. And the third thing, Mr. Dix, you need to do is to resolve, as we've heard today, to do this now. Not next year, not after the election, not in the future, now. Woo! Fiddling with the fee schedule is deck chairs on the Titanic. It's not going to avoid the catastrophe. Time to make the major changes is now. Patients in this province are suffering, and I fear dying as a result of adequate primary care. Mr. Dix, there's nothing wrong with saying that a plan isn't working. There is something wrong in ignoring the facts that show that it's not working and not doing anything in response.
What do we want?
Doctors!
What do we want?
Doctors!
What do we want?
Doctors!
This is now like a, one of them speed car things. They come in for tire change. And I apologize, we don't have a tent big enough for all you guys. Sorry. Patiently waiting up here, thank you for your patience, is Adrian Yee, Vice President of BC Nurses Union.
Good afternoon. I'd like to thank Camille and Alexis for inviting the BC Nurses Union to make a few comments. It's an honor to be here at the BC Legislature with all of you. Thank you. On behalf of the 48,000 licensed practical nurses, registered psychiatric nurses, and allied health workers represented by the British Columbia Nurses Union, we want to give a shout out to all the family doctors and acknowledge them on Family Physician Day, which is worldwide. It's recognized worldwide. I stand here as both an advocate and an ally. The BC Nurses Union urges government to take immediate steps to address the shortage of family doctors in this province. We know that the healthcare system can only exist when there's enough of all of us to provide health care. As a registered nurse nurses, I know firsthand what it means for patients, our healthcare system, if the family doctor shortage is not addressed and the primary health crisis deepens. During a visit to Victoria General last week, I witnessed how bad the situation really is. Many sick people in the need of care waited for hours packed in a waiting room. Last month, I toured Royal Inland Hospital and the University Hospital of Northern British Columbia and visited both emergency rooms. What I saw was exhausted nurses and ER doctors spending their shift triaging and providing care to whoever they could, running from patient to patient. Many looked defeated. For those who work in healthcare every single day, it is devastating to watch the incredible toll a lack of family physicians is having on people's health and the entire healthcare system. Without more doctors, people aren't getting the invaluable medical attention they need. Instead, they're having to travel to the nearest emergency room departments, often waiting 8, 9, and 10 hours. The nurses and staff are worked off their feet trying to accommodate this harsh reality. When patients arrive at the hospital, they are sicker than ever, presenting with health issues that are complex because they have deteriorated over time. Why? Because they don't have access to a family physician and longitudinal care. And sometimes, tragically, a delayed diagnosis means it's just too late for there to be a meaningful medical intervention. Without family doctors, people have no other alternative but to go to the ER. This cycle is unsustainable and unacceptable. Our fragile healthcare system is crippling under the pressure of two major health emergencies, the pandemic and the toxic drug crisis. It will collapse if we don't have healthy healthcare teams. This means that there must be enough family doctors, enough nurses, enough nurse practitioners, respiratory therapists, lab technicians, care aides, the list goes on. It means access to walk-in clinics that don't fill up in 30 minutes or require people to line up for 2 hours before it opens just for the chance to get an appointment. It also means that urgent primary care centers function as they were intended, to provide urgent and primary care, but they can't do that without doctors. It means accessible, timely health care for the 900,000 British family doctor. Last week, during National Nurses Week, hundreds of nurses traveled from communities large and small to rally in this very spot on the lawn of the legislature. Just like doctors, nurses have been watching the erosion of healthcare services in this province in horror, feeling frustrated, unheard, and disrespected. We stand with doctors today, and we know what happens when there are not enough of you. When I asked an ER nurse the other day what the shortage of family doctors looked like to her, she shared the following. It has become normal to see increasingly long wait times in the ER. Personally, I feel people are coming to see us with issues and concerns that could be better taken care of with their primary care physician, if they had one. I asked another nurse the same question. Her response? Without primary care, I find that there's a lack of education within the public. I've seen patients present much too late with symptoms such as facial droops and slurred speech. I think if we had more physicians, patients would be more knowledgeable and have a better understanding of how to treat certain things and when to worry and when to come and seek help. And another. With screening and primary care so difficult to access, I see patients, young patients, presenting to us and getting a new cancer diagnosis. I'm aware that also patients are receiving a diagnosis of metastatic cancer made by the ER doctors. I also see patients that have received other new diagnoses and they come to the emergency room for referral because they have nowhere else to go. While all of these are very valid health concerns, these patients should have a family doctor to support them and not have to rely on the ER. It is time for the people who work in this building behind me to wake up and listen to the province healthcare professionals. We won't stop rallying on the doorsteps until conditions have improved for everyone. Enough is enough. We can't stand to watch patients suffer any longer. Premier Horrigan, Adrian Dix. Last week it was the nurses rallying. Today it's for the doctors. What will it take you to realize it's time to roll up your sleeves and get to work to ensure accessible primary health care for the citizens of this province? Woo!
Thank you. I don't know how many times today I can say extraordinary. I don't care if it's a dozen. That was extraordinary. Thank you, Adrian. Thank you. I'd like to now introduce Dr. Adrian Fine, a retired professor of medicine and kidney specialist. We're in the stretch run here. I get that it's tiring and you've been standing for 2 hours. But we will be done soon, and we're going to try to avoid that bad cloud over there. Thank you.
Ladies and gentlemen, my medical career spanned 4 continents. The last time I witnessed people dying because of lack of primary care was in Africa. That particular government tried its best, but with citizens averaging earnings of less than $1,000 a year, it could do no more. By contrast, here, in one of the world's wealthiest nations, our provincial government's policies have led to the disintegration of our primary family medical care system. I will now describe the real life and death consequences of this travesty. Now, we're all well aware of the excruciating difficulties or impossibilities connecting with a doctor. But these issues are very difficult to actually quantify in a scholarly scientific way, and therefore that part of the problem does not appear in medical research literature. This is, of course, great news for our government. But there are many scientific studies reported in leading medical journals that convincingly show major, measurable deleterious effects of inadequate continuing care by a family practitioner. Here are some of the evidence-based established facts. Many studies have shown that not having a family practitioner is associated with increased hospitalization, increased visits to the ER, increased morbidity and burden of disease, and reduced medical compliance. Now, the ultimate test of harm by a medical system or therapy or lack thereof is the death rate. It is the most finite and absolute measurement possible. The question that must be addressed is whether too few family practitioners leads to extra deaths. Now, a spoiler alert. The answer is an unequivocal yes. And ladies and gentlemen, to a degree that will astonish you. Let me describe some of this scientific research.
and make it relevant to our situation here in BC. One study from Northwest Ontario documented over a 9-year period an increased mortality rate in those patients over 65 admitted to hospital who had no family practitioner compared to those who had one. After discharge of the surviving patients, the death rate after 6 months was much higher in those without a family practitioner. Now, adjusting those research numbers for our different and much larger BC population, approximately 1,500 patients over the age of 65 in BC will be expected to die per year on account of having no family practitioner.
Boo!
Now, obviously, I agree. As a point of reference, this is a very close number to the number of patients who died per year in the first 2 years of the pandemic. Of interest, most of the deaths, both in this research group and COVID groups, were the elderly and vulnerable, the very people our own government repeatedly claimed, at least during the height of the pandemic, that they especially wanted to protect. Our entire healthcare resources were skillfully activated during COVID. By huge contrast, the deaths of the mainly old and vulnerable, but also the general public, as a consequence of having no family practitioner, gets a mere shrug from our health minister or an angry expletive from our premier. Utterly useless and quixotic supposed solutions have been foisted on we hapless voters over years, and the situation has predictably worsened by the week. Another study from the United States combined the results of many similar studies, and they estimated that 121,000 lives in America are lost because of the absence of a family doctor. When you adjust this number to BC's population size, 1,800 lives are expected to be lost because of our current situation. A remarkably similar number to the first number I quoted from a Canadian study. Now, these deaths are preventable and entirely the result of successful governments, policies, and inertia. Magisterial and shameful incompetence is what I would say. If this were a corporate, non-political situation, such deaths might well qualify for the legal definition of negligent homicide. The response by our political leaders often involves giving out misleading statements by some, and sometimes insulting our intelligence in the process. For instance, our premier on TV a couple of months ago, when announcing how important the early detection of his cancer was, advised, wait for it, that people should go to their doctor as soon as symptoms appear. Mr. Premier, 900,000 of your electors cannot do this, thanks to your government inaction. And by the way, how come your most recent budget had $0 allocated to the family practice crisis? Our Minister of Health, God bless him, repeatedly has extolled the virtues of his creation, urgent primary health care centers that will address the crisis. A Trumpian charade, if ever there was one. As a vivid example of this, I recently, a couple of weeks ago, needed an urgent prescription. I went along to the James Bay Urgent Primary Health Center 1 hour before its closing time. I was told no doctor was available. Okay, well, it's later on in the afternoon and evening. But on further inquiry, I was informed by the lady in charge, quote, "We virtually never have a doctor here." So the word for this, I think, is boondoggle. Now, to add insult to injury, just hot off the press, $780 million found by our government for a new museum, yet no money available for primary care. Just 5% of that money, if injected into the family care system, would have a major, measurable effect in saving lives. Just 5%. So to finish off, our primary health care system has truly collapsed. And the tragedy of our situation is amplified by knowing that we elected these leaders who've allowed this to happen to us. They seem neither to have the will nor the wherewithal to urgently prevent many hundreds of avoidable deaths, our deaths. Because it is our lives that are being sacrificed, our voices must rise to the occasion and deafeningly protest. We must bellow from the rooftops. Unacceptable. 900,000 British Columbians surely agree with that famous Hollywood line, "We're not going to take this anymore." And we must demand, not ask, demand immediate change. Thank you.
So if you have anything left in your voice, let's do a new chant. Unacceptable. Unacceptable.
Unacceptable.
Unacceptable. Thank you. Our final two speakers you've heard from. And we are going to hear now from Camille. She's going to end our day before Dr. Lush does. And so if you have anything left, and I know you do, let's bring it for Camille Currie.
Thank you. Thank you all. I know it's been a long time for some of you standing, and I appreciate that you have all stuck around, and we've had some amazing speakers. I'm very grateful to all of you that came forward to share. Thank you very much.
Thank you, Camille.
So, right now though, I have my partner in crime, Alexis, with me, because it was with great excitement that we reveal to you the next part of our steps in this campaign. We have formed and registered an organization called Canada Pacific Healthcare Matters Society. This will be the formal organization that will support and advance BC Healthcare Matters objectives. It became apparent to us that if this crisis was to remain unresolved for much longer, then there was a genuine need for a citizen society that would be committed to pursuing actions for the long term. This society will be an extension of the work we have already begun. Today we stand witness to how people coming together with a common goal can achieve monumental things. We want to be witness to what is happening, and we want to put in place the actions that will achieve the results we all need and deserve. The intention of this society will be to work in a transparent way in keeping what we expect from our political and organizational decision makers. You can count on the society to conduct itself in this way. We intend to behave the same way we have been thus far. You know what we have been as a movement, and you know what we'll be as a society. Our reach and our actions will simply be scaled up. I was born here, I live here, in beautiful Victoria. This group started here, and many of the decision makers are here. But this will grow and expand. We have not forgotten everyone else in British Columbia. You all watching us today on virtual stream, we know you're there. We need to do more with this society, and we will. We want to roll out our efforts across the entire province. This society will advocate for the residents, which means we will continue to demand transparency and accountability, which means we will continue to press for transparency of UPCC expenditures and costs, which means we will continue to highlight the need for a family physician for every resident, and which means we will continue to question when new infrastructure is developed, but access to primary care does not change. Part of accountability is making sure people are getting what they are expecting and needing. We are sharing these patient stories with you today because this is what matters. The accountability is measuring whether the taxpayers are getting what they need. The story wall set up in our tents over here, that you hopefully will have visited and shared some words, will be a tool for our society. We will take time to hear what you've said. We want to hear what you have said, and we want to start work as a society focused on your shares. We will spend time considering what you have told us and let that influence our agenda going forward. You have started the work of our society here today by sharing with us your despair, your anger, your frustration. From this, we will bring you hope, and we will fight for the health system that includes you, cares for you, and respects you. Woo! It is now important for me to take a moment to acknowledge some very important people that have stood by me the last 5 months and supported me in the very best way with love and encouragement. I would like to thank my husband, Sean Currie, my son, Adrian Currie, and my daughter, Mila Currie. A cause like this doesn't turn off at 5 p.m. So without their support throughout all aspects of my life, I wouldn't be here today, fighting for all of you today. I would also like to extend an immense thank you to all the volunteers that have worked so hard to get us here today. You have been invaluable to this campaign. Lastly, I would like to thank the amazing Alexis Reid. I call her my number 2 all the time, but I'm very proud to now call her Director of our society. You have been pivotal to this campaign, and I look forward to being directors together. Before I leave you today, I have one last question for you. What does every resident of BC deserve?
A doctor!
What does every resident of BC want?
A doctor!
Thank you very much. Thank you all for coming out today. Thank you to all of our virtual watchers that are with us. Thank you for making the trip here, which was great lengths for some of you. And thank you to all of you that are watching at home and making this a priority in your lives. Now I will urge you to just bear with us for 3 more minutes to hear the most heartfelt, amazing writing that I've honestly ever heard from our dear Dr. Lush.
Follow up with your family doctor, they said. Tiny baby, fist clutching, reaching for a hand to hold. Breathing, feeding, developing. Will he walk on time? Will she talk just fine? I don't know. I am scared. New parent, unaware. Follow up with your family doctor. They will walk you through the growing years, the teen years, the attitude and lean years, the find your identity and lose your way years. Follow up with your family doctor in your doubts, your fears, your triumphs, and your tears. In your work and at your ease, in health and in disease. Cradle to grave, walk beside you, health to save, helping to be brave. Follow up with your family doctor. I am sick. It came on so quick. Navigating this healthcare system. New language, foreign terms, endless waits. Surgeon looking stern. Overwhelmed, all alone, so many questions, where to turn. Follow up with your family doctor. But I don't have one. Then who, then how, where am I going to get the care now? It is a truth universally acknowledged that universal health coverage means all people have access to health services they need when and where they need them. All people access. All people access. Access care when and where. Does anybody care? Access the care of a family doctor? Not in BC. Not for me. Not for 1 in 5 beside me. The time is here. The time is now. Do not allow them to tell us we deserve less than and how. Everyone deserves a family doctor. Everyone. Follow up with your family doctor.
My final extraordinary. Thank you everyone for coming today, listening to all the speakers. We're hoping and expecting that we will see all of you again, if not in person, certainly in spirit. Camille will be available for interviews. She will be set up over there. Finally, please pick up any garbage, anything that's loose items around you. Till we meet again, thank you so much for coming today.
Thank you all for watching. We're now ending the broadcast.